Hi, my name is Brittany Jones, and I am doing my health comparison paper on the United States and Canada. After doing research on different countries, I decided to choose Canada because it is one of the best models in the world today for healthcare systems. The United States healthcare system has made some serious changes in the last 6 years. I honestly don't feel the changes were all made for the better, and I'm going to explain the healthcare system, how each of them works. The Affordable Care Act is meant for everyone in the United States to have health coverage, and they offer subsidies to help citizens and everyone pay for the coverage. However, most citizens still can't afford it because it is quite expensive. The Canadian, everyone was also mandated to have health insurance by 2014, or they will face a financial penalty. The Canadian Health Care Act requires universal health care. Every resident must have be covered by public insurance plan run by their province on uniform terms and conditions. The basic definition of Canada's healthcare system is a group of socialized health insurance plans that provide coverage to all Canadian citizens. Their federal government sets guidelines, and it is publicly funded. Taking a closer look into Canada's healthcare system, we have to look back at the beginning of the universal healthcare availability to all the residents. The Canadian Health Care Act was enacted on April 1st, 1984 by Parliament and was introduced by Monique Begin, the Minister of Health at that time. The Act's primary objective is to promote, protect, and restore physical and mental well-being of residents of Canada. Also to facilitate reasonable access to health services without financial barriers or any other type of barriers. The debate over financial responsibility and what is covered under insured services that is currently restricted to care provided by a physician or in a hospital by the CHA. The frequently most misunderstood concept within the Act is that the health insurance plans must be administered and operated on a non-profit basis, so that the entity supplying care to residents are directly responsible for the 10 provinces, which also makes them subject to audits on their accounts and financial transactions. Most people think this deals with the delivery of health services when it actually is dealing strictly with insurance services. However, it does reduce the scope for private insurers to cover insured services. They are still able to cover non-insured services and non-insured persons as well. The Act also states that all offered services by physicians and hospitals will be covered under the health insurance plans. Although initial care and treatments are covered, it is left up to the individual provinces to decide if the additional services will be provided and granted. The definition provided for insured persons excludes members of the Canadian Forces and the Royal Canadian Mounted Police, inmates of the federal prisons, and also Aboriginal people covered by workers' comp. Residents moving from one province to another, as well as Canadians moving back home, are subject to a waiting period to a province or territory not to exceed 3 months before they are classified as an insured person. Section B of this Act lists 2 additional conditions which must be met by the province to receive full compensation from the federal government. The first provision is that the Minister of Health is entitled to specific information related to provinces' insured and extended healthcare services. Secondly, the province must give recognition to the federal government in all public promoting and advertising related to insured health services and extend healthcare services in the province as well. These 2 provisions have highly controversial in the public's outlook on federal power and distribution of wealth throughout the country. One of the requirements with the United States health insurance is requiring patients to have a financial responsibility. This is in the form of copayments, coinsurances, and deductibles. Each plan has different amount of copays, coinsurances, or deductibles. They could all vary, and that they could be responsible for. And this is on top of their monthly premium that they have to pay for their coverage. Every month they have to pay a certain amount to keep their coverage active. Every time they go to the doctor, they will either have a copay. Once the insurance is billed, they might be responsible for co-insurance until they reach their deductible, which could range anywhere from, $500 to $15,000. The deductibles can range, and just depending on the type of insurance plan that you have. In Canada, they are not responsible to pay anything. A study showed that 1/4 of Americans were satisfied with the availability of the affordable health care in the nation. Then it stated that 57% of Canadians were satisfied with the availability of affordable health care. Now, that is a huge difference. 57% of Canadians were happy and only 1/4 of Americans were happy. That's a pretty big difference. Now, when they questioned Americans if they were dissatisfied with the healthcare coverage, 72% said that they were. Only 17% of Canadians are dissatisfied. So that is an even bigger difference, from 72% of Americans being dissatisfied with the healthcare coverage to only 17% of Canadians being dissatisfied. The United States has been dating healthcare for over 100 years now. This is both on a national and state debates. During these debates, the question is often asked, which country has the best model for which healthcare that can be provided? There are various factors that determine the overall success of such systems, and the government intervention in the private sector maintain the availability and the resources of healthcare. Both countries devote a high proportion of their national wealth, with Canada spending about $60 billion, 9% of the GDP, and the U.S. spending about $600 billion, which is 12% of the GDP, on healthcare. The United States federal, local, and state governments account for 43% of expenditures, while the other 47% is covered by the private sector. Canada's federal and state governments accounts for 72% of their healthcare expenditures, which is much higher than the U.S. One reason for this is the government insurance plans that are offered to every citizen of Canada. Although both countries' insurance plans do not cover every possible injury or circumstance, there is a significant percentage difference between the two. Canada's out-of-pocket spending and private insurance coverage accounts for about 21% of their total cost, while in the United States the percentage stands at about 52%, which more than likely has already gone up. Government intervention in healthcare has also been heavily debated, with both sides making strong points. I personally think the government should regulate this industry, but I don't think they should dictate the insurance plans that can be offered to an individual. Canadians treat healthcare as a public service, which is exempt from the laws of the marketplace, price, and profit. Americans, on the other hand, favor limited government assistance and allowing the private sector greater control of the health market. Economics play a large role in the decision-making of an individual when choosing health plans. The United States market is based on choice rather than the ability to pay for services. The Canadian health system is available to all regardless of the individual's ability to pay. Although there are insurance companies in Canada that are not allowed to cover services already included in certain plans. There is also only one public insurance entity responsible for reimbursing physicians and hospitals through each province, which is not the case in America. We have a number of entities responsible for reimbursements. Low income, disabled, and the over 65 individuals can receive health coverage through Medicare and Medicaid services in the United States. These programs have their own set of eligibility requirements that must be met before the coverage can begin. For example, for Medicaid, you have to have a certain amount of income. You have to be below a certain amount of income to be eligible to receive Medicaid services. For Medicare, most individuals, you have to be at the age of 65, or if you have some type of disability, you will be put on Medicare as well. Um, Healthcare in Canada is a universal healthcare system, which means all residents are entitled to it, even if they seek medical services outside of their home. One of the requirements American insurance plans is staying in network when choosing their healthcare providers. There are regions of doctors they can choose from, and their insurance plan will cover their visits. If they go out of network, depending on the insurance plan, they could possibly have services done that are not covered by their insurance company, or they will cost them a lot more money because they are considered out of network. The United States, by contrast, does not have universal health care. The coverage per individual can vary from comprehensive coverage to none at all. Even with the introduction of Obamacare, the United States healthcare system seems to be getting worse. It is putting continued stress on providers to remain in compliance with the ever-expanding laws and policies. With all the improvements that the Affordable Care Act adds to individuals with no coverage or insufficient coverage, it is still not addressed the structural key points of the system by allowing states to directly choose between which Medicaid programs they will carry. This is further intensifying state differences and is keeping the United States from having a national healthcare system that is uniform and efficient. Canada has an equal access approach to healthcare for residents that ensures healthcare services. Obamacare is not so simple and enforces the notion that access to care depends on how much you can afford. The prices of premiums depend on your age, income, and health, even though this reform was supposed to leave pre-existing conditions out of its fine print. This is evident of the multi-tiered health system, where your benefits are determined by the level of care you choose and can afford, thus making providing healthcare services more competitive between companies and making it harder for individuals to sort through plans and pick the one that is most beneficial to their health and not their finances. So, with all that being said, Canada definitely has a universal healthcare system, and Obamacare, the Affordable Care Act, does not compare to the Canadian Healthcare Act. If I had the choice, I would like to have the Canadian Healthcare Act, but we are where we are, and what we have will, we deal with. So thank you very much.